Hi, this is Andrew Sears. I'm the president of City Vision University, and I'm going to give you an overview of our case management course. Um, Part of what's unique about this course is we're going to have one textbook that's focused on general case management, and this is really an overview and introduction. But we also are going to go really deep into the unique aspects of case management for substance abuse treatment, and that aligns with SAMHSA's TIP 27 protocol. But we're also going to try to do a lot of, what's different about Christian case management, and we're going to use some of our partner resources for that. So in this course, the goal is that you would take notes as you go through the videos and the book, and then we have quizzes. I think we have quizzes in this course. I'm not sure. Actually, I don't think we have quizzes in this course. Live meetings and forums, and then with the assignments is where you're going to be doing kind of the higher level learning and building towards a final project. Now, one of the key things for this course is understand how this course and how case management fits within the counselor career ladder. So we want all of our students to advance as much as possible in their own career ladder. So a lot of our partners will have this type of career ladder in their ministry. Now, if you work in a different organization, you might have something else. So often they have, the entry level positions, and often those are things like guest support. There might be multiple positions, but these are kind of the frontline positions. And in a lot of organizations, these positions are really challenging because a lot of times you deal with a lot more drama, a lot more chaos. So a lot of people who are starting there, you want to move up into more advanced positions. Think of it in terms of being on the front lines in the war. You don't want to always be on the front lines. So often the next tier in organizations is moving up to be a case manager. But to do that, you have to be good at case management and a lot of the skills that are in this course. Or if you're a case manager, and a lot of times what happens is people become case managers in organizations, but they've never really been trained in that. So how do you keep advancing? How do you get promotions? How do you get raises? It's to be good in these skills. Now, case management is in some ways a role for someone who's a non-licensed counselor. But ultimately what we're trying to do is to get you on this counselor's track. And in a lot of our partner organizations, you could become management and leadership in that too. Now, if you've taken any of our courses, you've probably seen that there's SAMHSA's TAP 21 8 practice domains of addiction counseling. Now, this course in particular is focused on service coordination. In some versions, this is actually just called case management. But a case manager is coordinating services for the client as one of the main roles. They're doing referral, they're doing documentation, and these are the three main areas. Now, actually, all these areas, ethics are important, and all these areas are important for a case manager, but these three are most important. Now, it's also helpful to understand how this course fits within our addiction counseling program path. So as you go through an undergraduate certificate, often what we're trying to do is really prepare you to be a case manager, or in some cases a peer specialist, or both of those. And you can get that as you're going through the certificate and go to an associate's. And then the next level usually is a certified addiction counselor, and most states will have level 1 or level 2. And if you want to get that, in many states it can be helpful to take our clinical addiction counseling path. Some states that's not required. We don't provide clinical addiction counseling paths in certain states. You can see this list here that is sometimes changing, so check the website for the latest updates. And then if you decide you want to continue, then you can become a master addiction counselor or a clinical supervisor, addiction counseling supervisor through City Vision's graduate certificate and master's. But you also, if you decide you want to do a pre-LPC track, you could transfer that to Liberty, and there's other paths that you can take for this. Now, if you go to SAMHSA, which is the main addiction counseling governmental organization, they have these career tracks. So you can kind of see, this is a more complicated version of the diagram that I showed you before, but there's these different roles that you have, and you have entry level SUD technician, which in many cases is a case manager. Associates, substance abuse disorder counselor, substance abuse disorder counselor, and then you can see at the top level is this independent clinical substance abuse disorder counselor, supervisor, and being able to do that clinically. So that's the SAMHSA career ladder. It can be helpful to understand how that fits into, if you have a licensed treatment center, usually you have a psychiatrist or MD at the top, and then you'll have LPCs and master addiction counselors. In some states, these are billable, licensed clinical social workers, clinical psychologists. And, one of the key factors in all of this is whenever you're running a licensed center, you're trying to make sure that it's billable through things like Medicaid or things like insurance. And a lot of Medicaid and insurance requires this level of certification. And that's part of why this level makes a lot more money. And then below that, you have licensed addiction counselors. In some organizations, those people are going to be case managers. In other organizations, they'll have case managers that aren't licensed. So another way of viewing this is a career ladder that looks at, you could start off as a certified peer support specialist, and then case manager usually is not certified, and that's kind of often a level above the certified peer specialist. And then you can go to become a certified addiction counselor, and most of our addiction counseling courses are helping you do that. We have our certification prep course that will help you do that also, and then you can go to become a master addiction counselor. That could then lead to an LPC. So as I mentioned, most of these are required to be able to be billable. In some states, you're allowed to be billable with the master addiction counseling. Now, I also want to talk a little bit more about just our certificate program. If you're in this program, you can kind of see that there's the required core courses. We have certification exam prep. You can pick between the peer support specialist or the addiction counseling certification. And then we have two categories, life skills electives and addiction counseling electives. Now, if you are in our Wounded Healers program, and that's really a program for anyone who is in recovery, especially if you were homeless, imprisoned, or in a residential recovery program in the past 3 years, this is our recommended path. And part of the reason why we have this is so we want you to take the vocation, calling, and purpose of work and the Wounded Healers, because that's going to help you in your own recovery path. And then the life skills courses really are helping you in your own recovery path. And then these are going to help you more professionally. So the Introduction to Christian Addiction Counseling, these start to be a lot more challenging in the case management course. So it's a little bit more work. So you have to assess, are you wanting to focus on your own, personal life skills development and recovery, or are you wanting to focus more on your professional development? But as you go through, start with these courses, then I would say take another life skills if you can, unless you need to take one of these based on what term it's offered. So hopefully all this is helpful, and if you have any questions, please ask your faculty. Thanks a lot.